help people understand what they need to be doing, and get all the paperwork done to send to Purple to set up the PAYE. It would need to be done over the phone because we're obviously not going out and visiting people at the moment, but over the phone and email, you know, we can set people up quite quickly.
Yes, because I think that was one of the questions, was around people who only just received a lump sum by direct payment for their family member. They were a bit worried about, if it's new to them, they were a bit worried about how that was going to work. So this parent has said, I've only just received a lump sum for direct payments to my family member. How can I spend any as it hasn't been started yet? And I'm here isolating on my own. I only have 2 people who have been DBS checked and they can't have my son or daughter at the moment. And will OCC ask for that direct payment back? It's kind of a 2-pronged question. So I don't know who wants to answer that. Robin? Karen?
I didn't really understand. So I didn't really understand that, because I saw that on the list actually when I was having a look. So the person has just received a direct payment. What, and they a lump sum, did they say?
Yes, it says a lump sum for direct payments.
Okay.
I'm not sure that.
And what's the
call? So really difficult to get them to.
I think they've just obviously got a lump sum of direct payment through, but because of the current situation, they aren't able to employ anybody because they're self-isolating. And so I suppose the question is, if that money isn't used, is that money going to be taken back by OCC?
It's Karen Buckingham here. I think that the normal rules would apply in terms of surpluses. So when they're reviewed, if there's a surplus in the accounts, then the normal application goes ahead on how much is actually returned. But certainly what they should do at the moment is talk to the person that's working with them, just to make sure that their needs are being met, because it might be that we can do things creatively just to make sure they're not going without altogether if they've not managed to source PAs to come in, but there might be other welfare checks or support that we can give. So it's worth coming back to the allocated worker. But if the budget isn't being used, then it would just be considered as any other surplus would in the normal processes.
So I guess in some ways it's just, you are looking at everyone as individuals in the same way that you would have done before, but you are being more flexible in the way that the payments can be used. Is that correct?
Yeah, I think that's right.
Absolutely.
Go on,
yeah.
Karen, you go.
Yeah, I think. Sorry, Karen's on this call. So yeah, I think you're absolutely right in terms of how you summarise that. What I would say is that I think Karen's point, which she's very clearly made, is that obviously if someone's been assessed as we've just described, where they've been assessed, have received a lump sum, but actually can't employ people because obviously because of COVID, I think, you know, if they've been assessed as having that need, it's really important. And again, a really important piece of our work at the moment is to ensure that, you know, we are supporting creatively in other ways if we need to do so. I suppose it's really reiterating that, you know, people aren't alone, and actually if they do need some support, we need to look at how we can do that in the interim in a different way.
Okay, Angela, I think you asked a question around siblings in the house and what they would need to do to become employees, and the same sort of rules around that.
So I imagine that Chris Witcher will tell me when I go to Connections, but I was just wondering what because I would have to become an employer to employ my older 2 children, because our support worker is quite rightly self-isolating and unable to provide support. So what would these 2 new, because I'd have to become an employer, what would the new employees need to do? I imagine they would need a DBS.
No,
insurance number.
Sorry, if they're family members, close family members, they're not going to meet the status under the DBS rules for completing regulated tasks, so they won't need to undergo a DBS check.
Okay.
Then they would be, usually what's been happening is people have been set up on a temporary contract, just for a few hours a week. And again, quite easy to set that arrangement up with family members if it's all been agreed as necessary.
Yeah, thank you very much. I have one other point to make about the surpluses of direct payments being taken back. Just to say that my experience with my 15-year-old son is that getting suitable care is almost impossible at the moment. So there's a lot of online support through things like Parasol and Keen and Yellow Submarine, all of which requires me to set up the IT, to work it out, sit with him all the way through, interpret what's going on, and basically sit and hold his hand to do it. So it might be termed as support. I think it's fun for him, but it absolutely isn't any respite for me. And therefore we will probably have a surplus unless I employ my 2 older children, which has some disadvantages in terms of their relationship. And like many other people, I'm freelance, so my workload has really shifted, and it's back-ended to the latter 6 months of this year as so many projects get pushed forward. So I will be hoping to use those direct payments if the surplus, if there is a surplus, towards the end of the year, because I've still got to cover all the summer holidays, all the Easter. Easter was covered by my husband, but there's an awful long way to go of this year. So I feel quite anxious at the thought that surplus might just disappear without perhaps taking a broader view of the year for parents who are looking after and now supporting 24/7 and homeschooling their children and young people. Because the reality is there's no way I can get the expertise that's out there. I have a fantastic social worker, absolutely brilliant, no complaints whatsoever. She could not be more attentive, but she is really limited as to what she can do, which is, and she's doing
actually, sorry, I think we got the
sorry, I'll stop.
That it's just that we kind of got a lot to get through.
Yeah, sorry, I'm shutting up.
Yeah, okay. I didn't want to say that because I'm a polite person, but yeah. And I'm also aware. So, is there any response, Helen? I am aware that I am aware now that I have forgotten to come back to you, and I will come back to you. So, was there any response to Angeli's comments? From
I mean, I'll respond to that. I think the really important thing about a direct payment is its flexibility. So I think that's exactly the whole point of it. And we are in very unusual times. So I think that is a conversation that, I mean, the direct payment is meant to work flexibly from 1 week to the next and 1 month to the next. So I think that working with you, we can make sure that if you're not getting breaks now, that you can get breaks later. And if you're not working now, then you need to work later, then we can flex around those sorts of things as long as we know about it.
Okay, thank you. Helen, sorry, I am sorry, I forgot you. Oh, I've unmuted you and you unmute yourself, it's fine. I think we were muting at the same time.
I think we were, that's fine. I think generally what's being asked is kind of what I'm asking as well, and I suppose I'm saying it from as parents. My son's home at the moment from residential college. By his direct payments were set up to pay providers like Yellow Submarine, Let's Play, and PA holidays. Well, we're not getting any PAs in to do anything, but we're doing everything with him, going for walks twice a day and doing, between us, and we're doing all that. As parents, can you claim some of the direct payment money so the money doesn't look like you're not using those hours, because we're providing those hours ourselves? Also, should we, if we've got the money for our providers like Yellow Submarine and Let's Play, should we still be giving them some of that money because they are doing some stuff online, and also if they don't have any funds, they're in danger of not being able to provide what they need to in the future?
Okay, it's Karen Fuller here. Shall I come in and answer that? So we're really clear. anybody that does have obviously existing recurring payments to providers like you've just identified, they still need to continue to be made, because you're absolutely right. I think what part of our council response is to ensure that, you know, we are supporting providers during these unprecedented times, because actually they need, it's absolutely vital that these support services are there when we're out of COVID-19. So we would expect that the existing direct payments would continue to continue to pay the providers, whether they're day services, whether they're yellow submarine, continue as you should. And I think you will have, and again, I'm very aware at the moment, I think like across the board, I think the post is rather slow at the moment, but everybody with a direct payment would have been sent a letter to say that we have given an increase to your direct payments for April to cover a 10% increase to ensure that we can cover additional costs associated with COVID.
So I should be putting an invoice into Purple still to pay those providers for what we would have used?
Yes. Yeah.
Okay, and in terms of the PA payments, because we're not using the PAs at the moment.
Somebody that wants to come back to that. So it's really difficult when you can't see the person's name. So it's who's got their hand up. I've just got a telephone number and somebody with a hand up on my screen. And you need to unmute yourself.
3348. Whoever's got 3348 has got a hand up.
Okay, I'll come back to that then, unless they want to interrupt us. There was an additional question to that, which kind of follows on from Helen, which is around, which is from Fran. What if the family member is an employer, as the employer can't usually be paid? How would that work?
Do you want me to?
Yes, please.
Put something into that, contribute to that. I think there's it's quite difficult. The person that signs and is responsible for the direct payment is usually expected not to be receiving money from it. Big conflict of interest. So an employee needs to have an employer, and that is normally the person that is responsible for the direct payment. So you can't really pay yourself from the direct payment. You can. It's a bit more complicated. I think there is means of paying somebody to administrate direct payments on behalf of somebody, but it's a bit more complicated. I think some family members have been employed, and that's increased their income at this difficult time, their overall income from one family member being employed and another being the employer.
Okay. Thank you. Does that answer your question, Fran? Unmute yourself. I'll unmute you. There you go.
Yeah, unmute me. Yeah, sorry. No, it's a question that a family rang me about yesterday. So 2 parents in the house, one the employer, and they have no other support. So the parent used to be, the employer, who was a parent, used to be an employee, but then realised that they couldn't be. And so are we saying then that they can't, or do they temporarily get somebody else to manage the finances? Because it's an exceptional circumstance. They've got nobody else, really, and this family are at breaking point, and at the moment having to do things they really don't want to do.
They still need an employer. For the employment rules and regulations, you still need to have an employer. So maybe
somebody else temporarily be an employer remotely.
It's Karen Fuller here. Can I just suggest, this sounds like a really, complicated situation, and I think it'd probably be really helpful to take this one outside of this call so we can look at it from a broader perspective, because I think there's lots of nuances on this case, and actually it'd be helpful to have some more information, then we can agree how we could proceed with that one.
Okay, that makes sense.
Okay,
Actually. Yeah, thanks.
okay, I'll tell them. Thanks very much.
Take that out of the meeting, and I guess one of the other questions was around day services when they're not running. I think that's been answered. We've got one from a parent who says currently this parent is currently a key worker, having to work from home. The young person is unable to attend school, employ a support worker to look after her during the week while she's working during the day, but is now covering some of those additional costs herself because she needs more support than she would have done before. That makes sense.
I mean, the first question I had on that one was, is why the person isn't at school, because all key workers' children are entitled to go to school. So I guess it's just whether we need to help them with that situation first off. Because I know some people have struggled that, and we've had to intervene with schools, and then we've had some successes around that. So that might be something that we can help with.
I guess it depends how vulnerable a young person is and whether they might be at risk themselves to becoming ill. So I think with some parents, if they know they've got a son or daughter who is in that vulnerable group, then they would not want to be sending them to school. So I guess it's
okay.
But again, we can, if you've got all these questions anyway, haven't you? So you're going to respond to them. Does anyone else want to comment on anything that we said or ask any questions from what we've said that I might have missed?
I'm sorry, Gail, it's Karen. I think there was a second part to that question as well, wasn't there? So I think Robin's absolutely right about the key worker, and again, we'd explore that first. But I think the second part was that the support worker is now having to do more hours during the day whilst they're working. So we would say, obviously, yes, discuss that with the social worker. But again, it goes back to my point that we've added an additional 10% to direct payments for a month, and this will, which hopefully should cover some of that. So again, we'd review that in 4 weeks' time.
Okay, that's helpful. Thank you. Jessica, you wanted to come back, haven't you?
Yes, thanks, Gail. I just wanted to ask Karen Fuller. She said a little bit earlier on that for families that have no support coming in, but have quite a lot of needs, then OCC would like to look at things flexibly and be creative. And I just wondered what sort of things they have in mind.
So we've got a range of things at the moment. So again, whether it's, and again, I know, I suppose picking up the point earlier where I think one of you did say that with some of the online stuff, again, that's create probably for additional pressure on yourselves because you need to sit with the individuals. But again, we have linked people up. We've linked some volunteers up where they can ring people. We've done various different things across different communities. But again, it really does depend, and that's such an individual question because it really does depend on what the needs are and what the circumstances are. So, and again, we've done a lot of online stuff. We have still got some very basic day services running if needed. So again, I suppose we're exploring that. We are across other areas of the service. We are still managing to get some very minimal support into people if needed. So again, it goes back to I think what's been key throughout all of this, that it's individual circumstances. And I think if you've got an individual situation, I think I suppose what I'm saying is that we would review that on an individual basis.
Okay.
We're encouraging a lot of activities online as well, where PAs can get in touch through FaceTime or all these other technologies. We've got Skype and things, so they can actually sit and do activities together if that person's able to engage in that. I take on board what was said earlier about that's not always practical or achievable, but for some people it works really well to maintain that contact with their PA, so it's another option.
And I think I would also add to that we do have across the board a number of PAs that are still actively working, and again we are supporting with the council, ensuring that they've got adequate PPE to come into individuals' homes. So again, that's I suppose just furthering my comment in relation to the fact that we are sort of trying to be creative and do things in a different way at the moment.
Okay, and on the point of PPE, that was a question that was being asked, and as kind of luck would have it, just before we started this meeting, Cassie got an email from Think Local Act Personal, which they've issued some information about providing PPA and testing, which is hot off the press, I think, isn't it, Kathy? So we forward that to obviously everyone in this meeting, and share that through our normal routes, because the fact that personal assistants can now get tested is quite good news, I think, for a lot of people. So personal assistants, and that also will mean people in supported living as well.
Okay, can I just add? Can I just add to that? It's Karen Fuller. So PPE, again, I don't think Oxfordshire is any different to anywhere else in the whole country in terms of the challenges around PPE. But I'd just like to, as a council, we have been really proactive in trying to get some additional PPE, which we have done, and we need to look at all providers and all PAs across the whole county. But we, for example, the Easter weekend, we delivered 62,000 bits of PPE equipment to different people across Oxfordshire, and that did include PAs, and we have had a number of PAs who have contacted us, and we've supported them with through securing some PPE. In relation to testing, you're right, there's lots of local discussions going on across the board, and we have probably since about Friday had some very opportunities to look at how we do test people. We have actually tested 2 PAs since Friday in terms of COVID testing alongside other members of staff. But there is, we are making sure, which is a piece of work being done today, making sure any local offers that we do have will do align with the national guidance in terms of testing, particularly around prioritisation, because I think most of you will will obviously concur with the media reports that COVID is only as good as the day that it's tested on. So there's really clear guidelines that in terms of symptoms when you do need to be tested, which is something that's been incorporated into our local guidance. But again, I think as you've obviously seen some local stuff, but that is going to move forward quite rapidly, either today or tomorrow, and then we'll be able to share that as well from a county council perspective.
And would that also extend to people who are living in supported living if they've shown that they've got symptoms?
Yes, yeah. That should be the case, because that's obviously in terms of managing. So that is something that we've included in our discussions with health. Okay.
I'm just thinking preventing any kind of, so we had a situation where right at the start of this there was high temperatures, and we now don't know whether they've had it or not anyway, but it's probably too late.
So the testing that will be done now will be based on current symptoms. It's not testing whether people have had it, but again, it's so key in terms of timescale. So, but there's some health has done a really good job of actually looking at a process for that, and I think we've used it 4 times since the weekend, quite successfully.
Okay, thanks.
Can I add something about the PPE? It's Louise Ackerman. Just to say that we do have some public guidance, and I hope that you've had the link to that already. If not, I can resend it, and that shows where personal assistants and family carers, etc., can get their PPE from.
Okay, I'm not sure we've had that, Cassie, have we?
No, we haven't, no.
Yeah. So if you can share that with us, Louise, that'd be great, because then we can alert that to families.
Yeah, thank you.
Lovely, thank you. Okay, so I'm looking at some of the, we've had a few questions around, when is it likely for day services to be open again and how, and I'm not sure anyone's got the answer to that, but I think one of the questions that came in was around how will the day support centres open again? Will they run as normal?
Louise, do you want to answer that?
So I manage our 8 community support services. They're all open at present and supporting people on a needs by needs basis. They've got they've set up a YouTube channel. They're supporting family carers with kind of doing daily walks so people can at least get out for an hour or so. and have a daily walk to help relieve pressure on the family. Some people are still attending the centres, so it depends on everybody's individual needs, and the community support services are really keen to do what they can to prevent family breakdown and be there to support you.
Okay, that's really helpful.
Can I just ask a question there?
Yeah.
So if a family feels that they need, if at the moment they're not being supported, but they feel that they're reaching that stage where actually it's now going into week 5 of lockdown, and they feel that they need that support, who should they contact?
If they go to their social care team,
okay,
and ask for that, but we do have some capacity to support more people.
Okay.
Because a lot of people are kind of self-isolating, and where they would have come all day, they're now kind of having maybe an hour or a couple of hours a week.
We also it's Robin. We also haven't had a lot of demand for the services that provide breaks for families, but for the reasons that you've just said, we recognise that getting into the 5th week, that might change. So if people do contact their local team, there are various options around that we can open up services and try and provide people a break. We just obviously need to manage anyone who's COVID positive or anyone who may have had exposure and needs to self-isolate, and then people who don't need that. So there's kind of 3 groups we're trying to accommodate, which isn't very easy, but we want to be able to support people. So it's important not to hang on and to let us know if things are getting a bit more difficult.
So I guess in some ways it's similar to the advice that we're hearing from the NHS now about doctors still being open, isn't it? You know, we're also focused on everything to do with COVID, but some things still carry on, don't they? So families are still going to fall into crisis. Families are still going to need social care input. Are they, and which would be my worry, is that some families will be just holding off doing that. So is there any way we can get the message out that in some ways, although we don't want to put more pressure on services, that there is some way that there is still a service there for families who need it? Is there any way of kind of advertising that, sharing that?
Yeah, I mean, I think in the usual way, because I mean, I think we've still got to do social distancing. We've got to do all of those sorts of things that everybody else has to do. But I think certainly in using the channels, I mean, certainly people are contacting us at the moment. So we've had a few people contact us when they were just struggling. So I think the important thing is that people have got the numbers. I mean, they should have the numbers, but they don't have the numbers. It's our front door, which we can obviously send, or the locality team. But to give one number is usually the most useful thing. So if we give the front door, and then that will make sure people get to the right place.
Great, thank you. And there was an additional kind of question to that, and this came up when we had our session with health staff last week, was around if the primary or single carer of somebody falls ill with coronavirus and needs to go into hospital, what help would social and healthcare team provide? And this could be somebody who's on a direct payment, who has a direct payment, but this is somebody who's normally living and cared for in the family home. And what number should be contacted in case of emergency? I think you answered that. It's the same. Is it the same number? But what would happen?
It is, and yeah, and we have had that situation happen over the last couple of weeks. And again, I don't want to avoid answering the question, but it very much depends on the circumstances of the person, what family they've got around them. Because of course, if somebody that they're living with has got confirmed COVID, then theoretically they need to isolate for 14 days. So we've got to make sure that we keep them safe, we keep others safe, and but we also make sure that they've got the support they need. So absolutely, they need to contact us as soon as they possibly can, as early as possible. Even if someone has become poorly, maybe don't wait for them to become really ill. Let us know so that we can plan as early as possible.
Okay.
And again, can I just say, it's Karen Fuller again, and just I know it's following the workshop that you did the end of last year. That is really this adult social care number in terms of the front door is easy to get to now on the website. So I know that was some constructive feedback that was given to yourselves. So if you go onto the council website, so if you want to direct people, there is in the first row it just says social and healthcare emergency calls, and if you click on that, it tells you who to contact, how, and you can either do that by telephone or online.
Okay, and we have shared that with some of our older carers, haven't we, Kathy, that information?
Yeah.
Okay, I saw somebody with a hand up. Is that Abby?
Yes, it's Abby. I'm really sorry. I had some problems logging in, so maybe some of the things have been asked. But I just wanted to say on this question about obviously a plan when a carer has been unwell. I can say in my situation, I am supposed to be in receipt of direct payments, which have now been stopped for some reason. I don't know why, but I did speak to my social worker and asked a contingency plan or a crisis plan. Obviously, I was anxious because, I mean, I live just myself with my daughter. Fortunately, my son is yet to come back from uni, but my daughter relies on the carers and myself. And when I mentioned this, I was told that, I mean, it was going to be done. And I was going to be, I was expecting to get some documentation so that I know for planning purposes that in the event that I become unwell or my carer becomes unwell or none of my family members are supposed to care for my daughter, what will happen? I don't have, but I've raised this issue. But
so when we had Abby, when we had our session last week, we talked a lot about having a plan and doing some planning yourself beforehand for your individual relative, and to make sure that that's there. I guess within that, to make it really clear that there's no actual backup and that you would need support from somewhere else, that would be really important. We're looking at maybe trying to do a session on the type of things families might need to think about, but unless anyone from social, Chris, I am going to come to you because I know you had your hand up, but does anyone else want to come back to that point that Abby made?
Can I just jump in? It's Karen Buckingham again. Just to say that in the review team, we're actually making calls to all the people with direct payments at the moment for just that reason, just to, firstly, just to do a welfare check because they're obviously in the review system and don't have an allocated worker per se, but also just to talk to them about what contingencies are in place should they become ill, and just making sure that people have had those thoughts and put pen to paper to actually think about what they would do. So we're proactively going through those lists. But also, you know, for individual cases, you know, do come back to your social worker or to the adult social care team that you're working with if you've got any concerns with that, to work through contingencies, or if you're needing any changes to your direct payment during this time as well.
Is it worth me just clarifying there?
All those things, but at the moment, I am actually not in receipt of those direct payments right now.
Okay.
But my daughter is supposed to be receiving them. I don't know why they stopped.
Okay. So
okay, can I?
Yeah.
It's Karen Fuller. I think this is probably going to be a case that, because at the moment we're not going to be able to answer that without obviously, you know, discussing your personal circumstances. So can I suggest that via Gail that we summarise and you come back to myself, Robin and Karen, and then we will have a look at your individual circumstance outside of this call.
Okay, thank you.
I think that's helpful. Thank you.
Gail, can I just clarify something? I just wondered if people might not know what the review team is. So basically what we've got is we've got locality teams. So in each of the 6 localities, so we've got West, North, East, City, South, and Vale, which is Abingdon. And then if someone isn't needing the support of a social worker at the moment, they are what do we do? They go to the review team, which is where people are contacted once a year. So what Karen was saying is, at the moment, we're contacting people more frequently at the moment because we wanted to check to make sure that people had contingency plans in place. So does that, I don't know, does that help just explain what the review team is?
Yeah, thank you. So Christine, and then Kania, I think you had your hand up, so come to Christine first.
Hi, yeah, I was just, it was good to hear about the welfare checks, because what worries me is that there's going to be a massive amount of direct payment users who maybe want to buy a badminton set for the garden for exercise for the person. And that's a simple request. It's perfectly reasonable if they're not having a PA in, but they're going to take the time of the phone call to have that verified. And that feels a lot of people are going to be clamoring really to get hold of somebody from the teams. And personal experience, it might have been a one-off. I just tried to phone up yesterday on the LD team and I haven't had a response yet, and I've left a message. I don't think people can wait weeks to say it's okay. These things, people need things now, you know, people need to think outside the box to replace what they would normally have in a day service, whether that would, and exercise so important, or else, you know, my daughter would be just sat in her room staring at the walls or just on a telly. She needs to get out. We need to be able to think out the box, use a direct payment in an imaginative way, and just get on with it. We're in, as long as you're within budget. But that's just my view. Sorry, but I can see a lot of phoning.
I think that's a really good point, Christine. Actually, I think it's a really good point, and I think that's one of was part of the initial question around flexibility. Is not just about who you can pay, but how you can use some of that. Because we're all trying to be really creative and imaginative about how we do things in this situation. So you don't, like you say, you don't want to be waiting. So who wants to come back on that one from OCC?
Sorry, just to clarify what the question was. The question was about where people can go if they want to have something quickly. Is that right?
I'm sorry, I probably wasn't very clear. It was more around perhaps having a little bit of a blanket guidance to say that people, if they're within budget and have some surplus available, can use it differently without having to go to the council, take up time trying to find agreement from a social worker. Because it, you know, I'm just trying to think that might be more logical. And
no, of course.
Reasonable.
I think that was the principle behind the 10%. Karen Fuller, do you want to come back on that one?
Yeah, I agree, and I think again we don't want to make the system really bureaucratic. But again, I think, like we've said a number of times, jet payments, we do afford that flexibility. And I think at the moment, in terms of we are in unprecedented times, you went out and bought a badminton set. I think, you know, when you did your annual returns, and actually, you know, you've got a justification for that. Like you said, it's getting people out and it's doing their you know, their daily exercise in a very different way to how it should have been recently. And again, that's why we've increased, in line we have with our other providers, some additional spend for some additional costs that we know will inevitably be associated with some people with COVID. What I would say is, you know, they're you know, allowing that flexibility to do things. It's when we're sort of spending, you know, the money in a very, very different way in a big amount. So again, I think for little things like that, I think absolutely, I wouldn't, you know, I think that we would absolutely encourage that as a council.
I guess what we need to know is that they don't, as Chris said, you don't have to go back and wait for weeks before you get that. Can families just use their common sense, and as long as it's kind of within their assessed needs in lots of ways, because it will be, just be delivered.
It's within their assessed needs, and I think, you know, we don't want to make it very bureaucratic. I would, you know, that's absolutely, you know, fine to proceed with that. What I think, you know, what I'm probably more also interested in is that, you know, obviously we've got some very robust ways of supporting people, including DPs, with a number of our workers working at home now. So if you know, if at the end of the day there shouldn't be considerable delays if people are going to teams to ask for response, because we've got some really robust local procedures. So we've set up hubs in every single area. So again, field things through like you usually would, and one would hope that if there shouldn't be any delays. If there are any delays, then you need to let myself know.
I was going to say the same thing. We're very much open for business. We've got good staffing levels. We've got all our duty systems working. So either by email or by calling, you should be able to get a response from your team very quickly. And like Karen said, people are well used to making sort of documenting what they're spending their direct payment on. So it's just a case of recording it, and it'll be self-explanatory. It's just if it's huge costs, then obviously it's best to make that call and have that discussion.
And just to follow up that, Chris, if it's Robin, if you could let me know which number you called, I'm interested to know who didn't come back to you as well. So if you could let me know, I can follow that up.
I will do, thanks. It would be me, wouldn't it? Worst person, but yeah.
Fine.
Thank you.
Great, thank you. That's really helpful. Canio.
I don't know, Gail, if you've had any questions about contributions policy, financial contributions.
No.
Yeah, okay then. So this is the main point I'd like to make, and I know there's been discussions about this with OxFSN, but I want to talk about it from how it actually affects elderly carers and people with learning disabilities who are still living at home with their elderly parent carers. And it's to do with how the financial assessment does not take into consideration legitimate household costs, such as rent and utility bills, putting aside any costs that in support of the well-being principle for what people like to pay, use their money to do what they want to do with. So specifically for rent and utility bills, the financial assessment won't include it, because if there is no rental agreement, and there will never be a rental agreement because people are living at home, so it's all about an informal household budget, how people choose to manage that money, and usually it's a family carer who's managing the money for their relative. So because parents or the person can't show that they're paying rent, because usually the bank account may be managed by a parent, for example, it means that the financial assessments team simply don't take that cost into account. And it means that ultimately the person ends up being charged for something which they can't really afford. So they're having to contribute towards the cost of their care when they can't afford it. And so really the council should be looking to try and reduce the amount they have to pay. And in most cases, I believe, if the rent is actually included, as well as utility bills and any other costs, it will probably wipe any cost that anything they have to contribute towards the cost of their care anyway. So that's the main issue I have with the financial assessments team, and that question is for the financial assessments team. And I know that healthcare is doing they've done a survey, and that's probably due out at some point. So it'd be interesting to know what the Health Watch Oxfordshire, what that comes back with. But at the moment, what's happening is, and this is serious, it means that because there's a dispute over whether people should be contributing towards the cost of their care, because it's not in their best interests to, it means that they're accruing a debt. So this is people with learning disability accruing a debt with the council, who then threaten to take them to a county court to try and reclaim that debt. So I think that seriously needs to be looked at by the financial assessments team. Working with social workers, they can use their discretion, because they know what the family situation is. For many of the older carers living at home who've been looking after their kids since they were children, now they're grown-up adults. So you know what the situation is. You don't need to have to put the burden of responsibility on old carers to try and produce lots of evidence. They can't just magic out of thin air. You can use your discretion to include notional costs for rent, and you can actually see the costs for utilities.
Canio, can I and also I guess at this point in time as well, there's going to be additional costs to families about having their sons or daughters, relatives at home with them all the time as well. I know my electricity bill is going to be anyway, and I'm going to let them come back and answer that, Canio, because I'm aware of time. We've got 2 minutes left. So it would be whether that's something they need to take away and come back with. So does anyone want to respond to that?
Yeah, it's Louise Ackerman here. So utility bills are taken into account in this financial assessment. There's a set amount per numbers of people living in the household. And we did have, Karen Fuller had a meeting with yourself, Gail and Kathy, about this issue?
I think you were there as well, weren't you, Chris?
Joe and me.
Joe.
Yeah. So I think at that meeting, I think all the points that you've just made raised were obviously very articulately put at the meeting, and we agreed that you would have we'd have a subsequent meeting with the financial assessment team outside of this. I'm not sure whether that did go ahead because obviously COVID then came in. So I think, you know, in terms of the points that you've made, obviously we've had a discussion outside of this meeting, and I think you've obviously made your points very clear, and I think we probably need to stick to the agreed plan that we'd look in terms of reviewing that, which was a meeting with the finance team to actually look at taking that off, because obviously you make some very clear points and very clear opinions in relation to the view that you've got.
And I guess for the purpose of this meeting, Kanya, this is not really COVID-19 related in the same. It's been an ongoing issue. So if we can,
it has, yeah.
I'm really conscious we've literally almost done our hour, and it goes so quickly, doesn't it? Well, it does for me. It might not be going very quickly for you. Sorry, if that's the case. Does anyone else have any further questions that I haven't asked or we haven't covered, or any points that they want to make before we close?
Sorry, it's Karen. Can I just make one more point? Is that okay?
Yeah.
Joe contacted me earlier regarding a question to talk about, are we aware of blanket policies of DNAR in care homes and all residents being kept in their rooms? So I just want to obviously say for the record, obviously there's been a lot of national coverage with care homes applying for blanket procedures, but we're not aware of anything specific to Oxfordshire. And obviously our position is that we cannot apply it as a blanket rule that advanced care planning should always be done on an individual basis with involvement from the person and the family where possible. So again, I think the second point is about are we aware as a council of people being kept in rooms? Again, no, we're not, and we'd expect services to follow isolation guidelines, where they apply to individuals, and follow obviously stringent infection control. But the national guidance for care homes does advise that services should follow social distancing. Again, this is an individual basis, but we're not aware that there have been any issues or nothing has been raised to the council where this has been applied. Which, if that was the case, then obviously we would need to urgently be made aware of that.
And I guess that's something that certainly we hear a lot from families, whether this is happening or not, that there are concerns about the support that their relative is getting. I mean, personally, I can't fault what's happening for my son, but I know if he was with a provider that I'd already had issues with about contact or communication, I'd be really concerned right now that I couldn't be the one going in. We have had a question from one family regarding that, which is their relative in a care home. He's elderly and has a learning disability. They used to visit every day because they were so concerned about his support, and they now feel really worried. So what additional sort of quality checks are being undertaken in this time? How can we have some assurance that those people are being well supported?
So in relation to, obviously, it is in terms of the quality checks, it is business as usual in terms of with our contact teams. It is remotely. So if we have got in safeguarding, it's still business as usual. So if we've got individual cases, and then we need obviously to be made sure that we're made aware of those as a council. What I would say is, I think in terms of, and again, I suppose this is in the broader context rather than in an individual case, in terms of where we're working together across the Oxfordshire systems, that's health and social care, working very collaboratively together. We do have like a gold command structure, which is gold, silver, bronze, and we do have a bronze cell, which is actually looking it's a bronze cell, they call it, that draws reps from across the sector, which does include care homes, and we're using that group to draw together the information and support we can provide for care homes. So last week, for example, we had a webinar for care homes to to address specific queries. So if there are issues that people are aware, again, it is about please make sure you do communicate them with us, because at the moment, although we're working in very unusual times, we do have, outside of COVID, business as usual. So we are following up things that we need to follow up. So again, it's about putting that all together. Communication is key here.
Yeah, absolutely. So if families are not getting what they need from their provider at that point, they can come to you and
Yeah.
raise that as an issue.
Yeah, so the case that you just alluded to, if they had concerns previously and they've still got concerns, and I'd expect that to be raised absolutely with us. Okay,
great. That's really helpful. Angeli, final question and comment.
It's a comment really. It's just to say that the clear messaging here has been very positive from social care, and I don't think that messaging is, I don't think you're selling yourselves well enough. I don't think that parents necessarily and families realise quite how much support is out there for them still, and business as usual. So I'd really urge you to look at your comms. Appreciate that many of the smaller organisations that you might have used to do that are maybe not going to be there for you to do that. But I think you've got, I think you're selling yourself short. But I've just come away from this feeling very positive and really energised to go back and sort things out with PA and do stuff online and go and buy some stuff. None of which I realised I could do. I started off thinking I'd have to give all the money back, and it was going to be, you know, so you've kind of completely swung me round, and there must be other people in my position. So just saying, get the messaging out there. Anyway, it's a comment and a thank you, really.
I guess thank you. And if there's anything we can do to help with that, we would. So.
And I think that's a really, and that's a really, really thank you for that comment, because I think that's the exact conversations that we've been had. And I think, again, in adult social care, being brutally honest, our key priority is the safety and welfare of everybody. And we have just ploughed into this in terms of making sure, which you've heard by the number of, illustrations that we've given today, how we've been doing that, and that exact conversation in terms of, the positive side of some of the reporting that we need to do is an exact conversation we had with our comms lead yesterday. So I may come back to you, Gail, to see whether we can do something collectively with you, because I think that would be a really good opportunity. And again, something that reaching out to, people who do obviously have considerable caring needs, and actually how we can look at mutually working together to support that during these unprecedented times.
Yeah, I think that would be really helpful. So let's do that. Great. Okay, so we're Cassie, did you want to say anything before we finish?
No, I think everything's been said. Just want to check Nicole's taking lots of notes from me.
And we have
did such a great job.
I did miss the first 5 minutes even after being reminded, so I'll get the hang of it eventually. It's the second time we've done this. It's not been too bad, I don't think. Well,
No, it's been a bit of a learning experience for us. So we we keep getting things wrong, we keep getting things right. So hopefully by the end of all these sessions, we'll be absolutely perfect, and everybody will be able to log on without any problems. But the main thing is just to make sure that people feel like their voices have been heard, and that that they're getting questions answered, which I think they are, and that we can feedback, which Angela did, which is say, actually, you guys are doing a great job. So thank you.
Chris, did you want to say something?
Just to finish off, that we've been doing some really good work with the council and the social care teams on phoning employers up that we're aware of. So there's a lot of joint working going on, and they are doing a sterling job, I must admit. Working in another council, I can see the difference, and the standard is pretty good in Oxfordshire. If anyone does have any employment questions, queries, they're more than welcome to contact me on my mobile or come through our helpline. Happy to answer those, because I know that there are a lot of questions that people want answers to pretty quickly. So please do phone Connections Support.
You're happy for us to share your contact details with everyone as well, Chris?
Yeah, absolutely.
That's great. Well, that's it. Thank you very much. We will be sending out some notes. I say we, I use the term we very Kathy will be sending out the notes and any information that we get from the answers from social care And just to say thank you again for coming on and giving up your time. It's been really helpful, I think. And so, yes, we'll let you know any ideas that you have for other events like this. I think we're going to be doing this for a while. More than happy to arrange on any topic if people are interested. So just let us know. And thank you for joining us. I'm going to close the meeting now. Thank you very much.
Thank you for having us.
Thank you for having us. Yeah. Okay. Thanks a lot.
Right. Bye.
Bye-bye.